a ratio marketing podcast. Have you ever wished you had a healthcare provider on speed dial?
Someone you could call to validate your product market fit.
Someone to listen and help you see your solution differently.
Welcome to Healthcare Market Matrix, a podcast to help you see your market clearly. We dive deep into the challenges faced by healthcare organization leaders that technology has the chance to help them solve. It's all about gaining the kind of understanding you need to effectively connect with your market. Join us as we explore the Healthcare Market Matrix. Welcome, everybody, to Healthcare Market Matrix. I'm your host, John Farkas, and today I am privileged to be in the Ratio studio with Trish Rivard. And Trish is a healthcare technology and revenue cycle expert, and she has a real passion for translating market feedback into actionable strategies and investment. So, how does one become a healthcare technology and RCM expert, you ask? Well, Trish began her career at the Federal Reserve because where else are you going to get great experience in revenue management? But she helped spearhead a strategic payments and research group there. And then after about a decade at the Federal Reserve, she managed outsourced revenue cycle for hospitals at R1, where she got a lot of hands-on experience with denials and prior auths. And then she moved over to the technology side as head of product for TriZetto Provider Solution for TriZetto Provider Solutions, where she managed revenue cycle portfolio of about $135 million that included all RCM products and services, new solution development, and operationalizing new products and product ideas for hospitals and physicians. But then after she spent some time in that realm trying to understand the market that she was endeavoring to serve, she saw a really clear gap. And in 2015, she founded Eliciting Insights, which is a marketing research group that's aiming to bring quality market feedback to healthcare companies and investors. And they're working to really work to identify true market needs, to develop a blueprint for accelerating growth, to align product roadmaps with strategy, to learn what markets are going to be willing to pay for, to discover what factors drive actual purchasing decisions. They're looking at revealing the current and upcoming competitions, so are able to discern competition trends, and working to understand what growth opportunities exist in the market and how you can capitalize on them. So it was a need that she saw lacking, or that she was having a hard time finding resources to answer. And so she decided to jump in and make that happen. So other than the fact that Trish is a good friend and a part of the Ratio Advisory Board, we both share a passion for cycling, and we may or may not have stole away from a recent trade show to grab a quick 30-mile sanity ride along the Cumberland River in Nashville. We may have done that, but I'm really excited to talk to Trish today because Eliciting Insights just teamed up with the HFMA to release a fantastic comprehensive report that uncovers the health system's finance and revenue cycle purchase plans for 2023. And so that is what we're getting ready to dive into today. So Trish, welcome to Healthcare Market Matrix.
Thank you. Thank you, John. Excited to be here today.
So I should mention, in addition to the fact that we share this really geeky interest in healthcare technology and how it works, we both spend some time on bicycles. And Trish is an avid triathlete. She's in the process right now of, to celebrate a momentous occasion, which we won't put numbers together. I'll just tell you that she's doing 50-mile bike rides in the not necessary future. And I'll leave you to the conclusions of why she might want to be doing that. But other than some level of insanity, which we all share in the cycling world. So our opportunity today is to dive into some of this report. Tell us a little bit about your relationship with HFMA and how this report came to be, Trish.
So HFMA, so I've been going to the HFMA conference for, I don't know, maybe 8-10 years now. It's a great organization overall and a really loyal member base. And last year, actually Carol Romashko, one of our mutual friends, introduced me to Rita Walker, who manages the channel partner relations. And Rita and I started talking, and we shared some of the work we did. And they were looking to bring additional value to, they have a peer review program for the healthcare technology vendors that sell to hospitals. And they were looking to bring more value. And so in our conversations with the peer review vendors, one of the things that the technology vendors said would be really helpful is, if we could get feedback from the market on what products and what outsourced services, what additional services they're looking to buy, that would be hugely valuable for us. We'd really love to know what the market is looking to buy, so that if we have 3, 4, 5 solutions from a sales and marketing standpoint, we know which ones to prioritize. From a product roadmap planning perspective, we know which ones are the ones that the market really cares about. From a strategic planning perspective, these are the areas we can focus on. And they also wanted to know how a more granular level. So health systems with Epic versus Cerner versus Meditech, what solutions are they buying? Also look at the market by region, look at it by bed size. What are the larger health systems looking to buy versus the smaller health systems? So really that was the vision for the report. And then, the HFMA decided to move forward with that. And so this is the first in a series of reports. But, in addition to bringing value to the peer review, we thought this was also something that the HFMA membership base, as well as investors and other health tech vendors, would give value out of. So the report's also available for purchase on our website.
Awesome. And for those few of you who may not know what we're meaning when we say HFMA, because the world is awash in acronyms, it's Healthcare Financial Management Association. And this report, I'm curious, because I think that it would be good for our listeners to know, Trish, how you even begin to approach a project like this. So how are you identifying audiences? Who are you? What types of people are you talking to? How is that coming together?
That's a great question. So in the Eliciting Insights, we do a lot of market research. The way that we like to approach things and the way we approach this project is we started with interviews of CFOs. So we interviewed 15 health system CFOs, and really, what are your challenges? What are your priorities? What are your pain points? What are you focusing on? We really got the context and landscape from the ultimate buyer for revenue cycle and finance solutions. And then from there, we designed a survey. We launched the survey, and altogether we got 321 responses. For a survey, we did include the CFO, VP, and director. So we went down to the director level. And typically the director level in a health system, they may not be the final buyer, but they are a key influencer, really, because they're looking at the future functionality, they're thinking about integration, they're thinking about day-to-day workflow. So we really wanted to get a view of purchasing from both the key influencers as well as the final decision maker. And for the HFMA with this really strong, loyal membership base within the health system community, it was great. From Eliciting Insights, we have our own proprietary panel, and typically, our surveys will be able to get 100, maybe up to 200 responses for a project like this, and for this particular project, we were able to get, like I said, 321 respondents.
Yeah. And I I know a number of you out there who are listening to this have direct application for an organization like Eliciting Insights that has a ready group of humans, and they have a great methodology for getting the kind of information that you need to help inform your marketing plans. So lots of good there, but certainly some great insight in the context of this report. And we're going to dive a little bit into some of what you learned. because it does. I mean, there were a number of things that I saw that were really surprising to me, and in some sense, just helping me define how hospitals are looking at things. There's certainly been a major movement in how hospitals are addressing revenue, how they are, and some of the weight that they are putting behind some of these initiatives. And so, based on the HFMA Health System Purchase Plans 2023 report, that's what we're talking about here, that you just released, 79% of health system C-suites are planning to buy new solutions in finance or revenue cycle. So I know it surprised me. Trish, I'm curious if that surprised you.
So no, actually it doesn't surprise me. I mean, I think with the pandemic, purchasing has slowed down significantly. And, we've all been sitting here saying, is there a recession coming or not? But revenue cycle is something that's so important for health systems. So in order to get paid from payers, I mean, payers are, they're adding in layers of technology that'll make it harder, make it more challenging. I mean, we see it with prior auths. So payers are constantly evolving and finding new ways of making it more challenging for providers to get paid. And so providers need to keep investing in newer technology, new ways of getting paid. And we've seen a new solution. It was included in this report, but it's insurance discovery. So it's a solution where the vendors are actually helping. So if a patient's insurance is denied for lack of coverage, or the patient presents as a self-pay, then these solutions are really, going out and looking at all the different payers and seeing if a patient has some kind of hidden coverage or unknown coverage, and then attempting to bill for it, right? So that's kind of the next level of solutions we're out there. So there's always new things out there, and providers really need to stay on top of it, in order to maximize their reimbursement.
Yeah, there's definitely some movement in that realm, and interesting to see that how they're responding. I know that Waystar recently announced plans to IPO, and I'm curious, in light of some of that, what does that mean for the overall RCM ecosystem?
Yeah, so it's been really fun to be in revenue cycle for the past 15, 20 years and watch it evolve. Because there used to be a lot of different point solutions, and then we've seen this kind of evolution. And I really see the Waystar IPO as part of this overall evolution, right? Where you have a lot of small players, and then the small players get, there's some kind of roll up that's happened on the technology side of revenue cycle. And, now one of these roll ups, which is Waystar, is now at a point where it's going through, and is about to go through an IPO. So really kind of that maturity in the market. From a provider perspective, hopefully when you get to that level of IPO maturity, we'll start to see, really good integration in these rolled up platforms. So that's the hope. But, integrating does take a lot of time and, financial investment to get there. The other thing that's interesting too is to see the difference between tech and services. So on the outsource side of revenue cycle, we still see a lot of smaller players out there, and we really haven't seen. I've been kind of waiting, like expecting that we're going to see that level of roll up of the outsourced services, and we haven't yet seen it. So it'll be interesting to see, if kind of that maturity in the outsourced side starts to happen. We start seeing roll-ups and ultimately IPOs.
Yeah, I think that my whole, everything I'm seeing and reading and taking in right now says we're going to see a lot of consolidation in this next 18, 24 months. And I would expect that would be part of it too, just in knowing what some of the systems are demanding as far as simplicity and the ability to not have a whole bunch of different points of integration and connection and communication. The need to pull a lot of that together, I think, is going to be important. Anything else around the Waystar movement that you're seeing?
Well, just to continue your line of thought, health systems are looking for fewer vendors. So one vendor is better than three vendors. But on the flip side, we're also seeing health systems aggregating, and a lot of M&A is taking place in the health system side, which which also lends itself to the more consolidation, the more single vendor, right? Because when you're a larger health system, you don't want to have 40 different vendors at each of your facilities. It creates more complexity.
Yeah, so you kind of you jumped into another thing I was curious to ask about, and that's the whole M&A sequence. So I've got to think that with all the health system, the hospital health system mergers, movements, combinations, that has some impact on vendors. What did you see there?
Oh yeah, and actually we dug into that in our study.
Yeah.
So really, what's happening is
that's why I asked, because I know you did.
As health systems merge and become consolidated, right? So the goal for a health system is to standardize and streamline, save costs, and also have more negotiation leverage with payers as they consolidate, right? So as they're thinking about vendors, they're looking to consolidate as well, and and really have fewer vendors, right? So from a vendor perspective, you have to be in with a corporate level, and sometimes you might be in with a corporate level and actually win an RFP at the corporate level, but you might be one of two or three vendors that win the RFP, and then you still need to sell the individual hospitals or like sub health systems within that health system. So from a vendor perspective, I'd say, be on your toes here, because if you're in with a health system and they get acquired, make sure you're developing those relationships with the corporate portion of this health system, and make sure you're there at the table if they're issuing an RFP, because that's how you're going to stay in long term with these health systems.
Yeah, and it has a lot of implications in the marketing realm too. If you are an organization that is already in some a hospital or health system that's undergoing some form of transaction, your proactive efforts in communicating into the acquiring party, or however that might be happening, is all in your best interest, because the amount of affinity and awareness and understanding of your value proposition and what you're bringing is, no telling who the influencers are and the parties that are going to be pulling for you or for one of your competitors, right? And so it's important to do that work and understand who you need to be communicating to, how you need to be building awareness, and what that movement needs to look like.
Yeah, no, absolutely.
So I noticed that prior authorizations are the top solution that health systems are planning to purchase. And I was curious what you saw as driving that. And I keep reading that payers are dropping prior auth requirements. Tell me what that picture is shaping up to look like.
Sure. Great question. So prior authorizations, so they're an important cost management tool by payers. I don't think that surprises anyone. Prior authorizations, we saw them, back in the start, really in the, gated HMO, Hillary Care days. But really prior authorizations, it was more expensive procedures, but what payers have presumably learned is the more prior auth requirements, then the more money they make. Providers are giving pushback though, because the number of procedures requiring prior auths keeps growing, and so there's a lot of the provider community, various trade organizations, provider facing organizations are giving pushback, and so now we see payers. We see United Healthcare. It was back in May, June, where they said, we're dropping prior authorization requirements. The same day they dropped prior authorization requirements, they actually released like a whole new set of prior auth required procedures. So I think we're all kind of scratching our head as to what's going on here, but it seems to be more of a, marketing play more than anything. It'll be interesting to see if payers really do drop some of the prior auth requirements. But prior auths, it's really hard and it's really challenging for providers, right? So in order to get a prior auth, you need to know what the correct insurance is for the patient. That's not always a given. And the second thing you need to know is, does this procedure for this particular payer require a prior auth? And then the third piece is you need the payer to actually give you the prior auth, right? That whole back and forth of providing the documentation.
Lots of connect points there.
Yeah, so lots of connect points, right? So, just starting with what insurance the patient has. Well, a patient can walk into a hospital and say they have Medicare, and the hospital can actually check to see if they have Medicare, and it says active coverage. Well, the patient might actually have Medicare HMO, but it's still showing up that, it shows up as active coverage when they check in the Medicare system, or at least it used to. I presume it still does that now. So, so that if it's Medicare, then the patient doesn't need a prior auth. And then, but if they have a Medicare Advantage plan, then they do need a prior auth. So now we have the wrong coverage on a patient. Patient receives the services, hospital assumes they're getting paid, and then lo and behold, it turns out that they just didn't have the coverage right. So it's
not a great impact on revenue.
Yeah. So then it's denied, and you didn't get the prior auth, and you provided the procedure without checking with us first and whatnot. So this is a really challenging environment. I've also heard of other scenarios where a health system might call, like let's say they call the payer. And they say, I'm calling to get a prior auth on this particular procedure. And the payer says, actually, you don't need a prior auth. You're fine. So, okay, no prior auth needed. Provide the procedure. And then the claim gets denied for no prior auth. So, so you kind of look at all this and you say, wow, this is a real hot mess, and it's really challenging and frustrating for providers, and the amount of resources that they spend on prior auths.
It's crazy.
It's crazy. And if you look at the report, the second solution, number 2, right behind prior auth, is denials. And, it's funny, until a couple of years ago, denials was number 1. Now prior auth has taken that number 1 spot, but denials still a close second. But the two are very closely related, right? So if you don't have a valid prior auth, then your claim will be denied for no prior auth. And typically when it's authorization related, these are typically higher dollar claims than the other, maybe more technical denials that providers are working through.
Yeah, so safe to say that the whole prior auth ecosystem is pretty heavy on the minds of folks in this world, and that's just worth knowing that that's going to consume a lot of space and energy. If you have a solution that isn't necessarily prior auth centric, you're going to be coming up against a lot of current in that space right now, just trying to effectively solve for that problem, if that's even close to possible, if the word effective even can belong there. Which
and the solutions out there, they're doing their best, right? So a combination of creating a rules platform of which payers require prior auth for what procedures, and then using RPA to go to a payer website and pull the information, and trying to automate as much as possible of the prior auth challenge.
Yeah. So talk a little bit about what other areas of RCM are health systems looking at investing in. So we know prior auth, that's up there.
Yeah, prior auth.
What else? What's coming in under that?
Yeah. So patient self-service. So during COVID, what we saw is patient self-service became really important. And when I talk about patient self-service, it's that pre-check-in. So, Phreesia is a company we hear a lot that's in this space. You get a link and you can fill out your information before you walk into the hospital or the provider's office. That's
I did it last week.
Yeah. And it's a great patient experience when it's done well. especially when they have your information, it's pre-populated versus, when you walk into the hospital or physician's office and you get a clipboard and you're refilling the information they have on file for you that they've had for the past 20 years. So, so the patient self-service, and another component of patient self-service is self-scheduling. That's an area that patients want very much. We actually we had done another study on the consumer side of self-scheduling, and even the baby boomers want self-scheduling, which is fun to see. So patient self-service is definitely a category that that we're seeing a lot of traction, and really we saw it take off during COVID. And a lot of the health system executives really in that registration patient access area wanted to move forward with this patient self-service, but they weren't getting the budget. But when COVID hit and became a patient safety issue, that's where we really started to see this take off. Other areas of revenue cycle that there's a lot of interest in is in that mid revenue cycle. So coding automation. So we asked about computer-assisted coding, which we saw a strong demand for, and then a slightly higher demand. So about 26% of the market is looking for autonomous coding versus 23% said computer-assisted coding. I think that really tells you that coding function. And we've seen the demographics on coding. A lot of coders are retiring. When we transitioned from ICD-9 to ICD-10, we saw a lot of coders retired at that time. So we all know about the nursing shortage, but there's also a coder shortage out there as well. So that's a really important area of demand in the revenue cycle. And then also what's called CDI, so clinical documentation improvement. So we saw 28% of the market is interested in CDI solutions.
Wow.
So clinical documentation improvement, really it's when you look at the medical record and you say, is all the information that should be there, is it properly documented? Did the physician potentially go through this a little too quickly and not document some things that we could actually get reimbursed on? So that's another area there's a lot of focus and some really interesting solutions out there.
Gotcha. Was any of that surprising to you? Anything there that was a standout?
No, actually, I think a lot of the, I guess I was surprised that, in maybe the nuances of the order that patient self-service came above clinical documentation improvement. But no, I mean, those are the solutions that we were actually expecting to see bubble to the top.
So I know that there's a lot in there, and you just mentioned a lot in there about automation. What areas of revenue cycle are really, what is the adoption for automation? What types of things are really catching traction right now? What do you see in there?
Yeah. So in in healthcare technology, revenue cycle, there's a lot of AI out there and whatnot, and a lot of it is actually robotic process automation, and that's fitting, right? Because when you think about revenue cycle and what revenue cycle is really just a lot of manual blocking and tackling to get claims paid by the payers. So we've seen a lot of RPA in things like back end follow up. So in that business office function, you get a denial. The payer's not denying the claim because they're requesting the medical record first. So you have to go, you pull the medical record, and then you use the RPA to go pull the medical record, upload it to the payer website, and really get the that claim to the next status within the workflow. Also prior auth. So prior auth is another good application of robotic process automation.
Yep.
Other areas of true AI we're seeing in coding. So autonomous coding is using AI, machine learning, natural language processing to be able to code a claim. And then clinical documentation, also we're seeing, natural language processing. So fair bit of natural language processing in that mid rev cycle, which makes sense, right? Because you have this unstructured medical record that, having that machine learning come on, that NLP machine learning come in can really, help, make things much more effective and efficient for the human.
Yeah, there's definitely a strong current I'm catching nearly everywhere around the whole automation of documentation that I think we're better situated to do now than we've ever been, and it's going to be interesting to see how that plays itself out in the compliance realms and how we're able to really watch AI replace a lot of the stuff that's driving people crazy right now. So I hope we see some good movement there. What are you seeing happening with full outsourcing? I know you previously worked at R1. Is that a high area of growth right now?
So interesting. So we've done a fair bit of work on looking at the market, trying to understand full outsourcing. And from our study, what we found is that 9% of the market currently is fully outsourced. And when we say full outsourced,
What percent of the market did you say?
9%. 9%
Okay.
of the market is fully outsourced, and fully outsourced is. It's really tough because CFO
a lot of
is
interface that needs to find its way to done in that.
Yeah, and the CFO is used to being responsible for revenue cycle. So now taking that entire function, which is an operational function within the health system, and having the entire thing managed by a third party is it can be very intimidating.
Yeah, it feels a little unnatural.
Yeah. So, but having worked at R1, having I have colleagues who are at Ensemble right now. It can work very well. It can work very well because the outsource vendor brings in technology, it brings in people, it brings in experts, and and some best practices. So I've seen it work really well. And, I actually think that, over the next 10 years, we're going to see more of this full outsourcing. What we found is that 4% of the market who is not doing a full outsource, so 4% of the market has active plans to do a full outsource. When we interviewed CFOs to start the project, we actually had several of the CFOs say, a way for us to improve our margins that we're seriously considering is doing a full outsource of the RCM. Then we had another CFO that said, if we weren't actively looking to be acquired, because that's actually one of the ways that CFOs and health systems are, looking to alleviate their margin pressure is if they have negative margins, they're actually looking for an acquirer. But if we weren't in this position looking for an acquirer, then we would be actively pursuing full outsourcing.
Gotcha. What else would be good for us to know about this report, Trish? How are you seeing it being used currently?
Yeah, great question. So we've gotten some really good feedback from the HFMA peer review vendors that that provide some really good information. Our hope is that it will be used by the strategy teams at the various vendors and the product teams, right, for roadmap planning. So, my background in product, and these are the data points I always wished I had. So those are some of the things that we're hopeful. Have heard from one of our clients that does the strategic planning that the information was exactly what they were looking for and needed. So excited about that, and then we're hopeful that the private equity community that's looking to invest in revenue cycle, is aware of this report and gets a chance to take a look at the numbers and see where the investment areas are.
Gotcha. talk a little bit more, pull us into Eliciting Insights a little bit more and talk about what you all do. Because this, obviously this report isn't everything you do. It is a sample of what you do. But, knowing that we're talking to healthcare technology marketing professionals here, what would you want them to know about the kind of services that you can provide and the questions that you can answer?
Well, so I was actually at this small business event earlier this week, and I said I have the greatest job in the world, right? So I get to interview health system CFOs, recently interviewed chief medical officers. We just get to be on the phone with various revenue cycle and other hospital executives, even sometimes the provider executives. We really get to ask them about what their challenges are, what they would like to see as a new solution in the market, or how they think about various problems. So from that's really the core of what we do, is we interview and we survey the market to understand what their challenges or pain points are. And the whole reason that I started Eliciting Insights back in 2015 is, as a product executive, managing a portfolio of healthcare technology, and you have your investors, you have various executives. Everybody's got an opinion on what product we should build, but you don't have the market
They have
data.
Opinions, really?
You don't have the market data to say, we should really build a denials management solution because, that fits with what we do. And, oh, by the way, the market will buy it if we build it. So you wind up building some solution that, somebody champions, or because it's easier for the development team to spin up. And then you spend a lot of time, or at least my experience, maybe this is very unusual, but my experience has been then you spend a lot of time scratching your head saying, I wonder why nobody's buying our solution. So really that's the genesis of Eliciting Insights. We have a proprietary panel. We have over 3,000 panelists that we tap for surveys and interviews, primarily health system. We do have some provider facing panelists, and really, if you think about the core of what we do, the foundation is, the qualitative and the quantitative market research. Then the services we provide are really leveraging that, qualitative, quantitative, this very robust panel we have. And so, things like buyer personas are something that we do for clients, or we'll do win-loss interviews. We'll do NPS was really popular a couple of years ago. We will do roadmap planning, help our clients really, which product should they be building, which they're more of a market appetite, what feature functionality, competitive analysis. That's something we get asked a lot. Recently, pricing studies are something that we've been asked a lot to do. We also do content development, right? So we have clients that want to create white papers or some unique content. They'll say, hey, can we do some interviews and surveys so that we can come out with some nice, citable market data? That's another area we focus. Strategic planning, love doing strategic planning type work. That's really fun. And then M&A work, where an investor or a strategic is looking to buy a company and add it to its portfolio.
Yeah, I'm a big fan of the pragmatic marketing school. For those of you who are not aware of pragmatic marketing, especially those of you who are touching product marketing, you ought to go check out pragmatic marketing. But one of their famous maxims is that your opinion, while interesting, is irrelevant. I am amazed at how many decisions get made in healthcare technology, any technology organizations around roadmap and stuff like that are based on guesses, really, or a very thin sample of experiences that people project out or multiply out to make major roadmap decisions. And there are ways to actually learn what the market is prone to do, and it's not a cheap endeavor. It costs something, but it's a lot less expensive than developing the wrong product.
Yeah.
And
Yeah,
or a product that is not going to get the kind of a market adoption that you were hoping because you pointed it in the wrong direction. And that's the kind of work that Trish and her team are ready to do. They are as well connected as any I know in this market, and ready to help get the kind of insights that organizations need to make the kind of meaning and the impact that you're wanting to make in the market. It is a critical tool, because understanding product market fit, understanding who's getting ready to buy what, and what they're actually looking for and what's critical in there, is not it's not something best left to chance. Why guess when you can know, or at least know better? Nothing's ever certain. The world moves quickly, but what stuff like this report is demonstrating and showing is some really strong foundations to base decisions on. And I am just consistently surprised at how organizations are willing to go forward on conjecture. Not necessary. You can build a better foundation.
Yeah, and I think we've all had the experience, right? We're in a room workshopping with other people, and there's a niceness factor, and there's a hierarchy, right? So if somebody at a higher level wants something to move forward, you just naturally give that higher weight, and depending if you do a formal rating or not, right? Because that person is, higher level, or, you don't want to shoot down anybody else's ideas in front of them. So in the absence
we call it RCB, recent conversation bias.
Yeah. Yeah.
It's very strong.
So in the absence of good market data, there's a lot of bad decisions that are made, to be nice, or to be, or because of biases. So, so I love what we do. I love the work that we do. It's been fun. I just wish that Eliciting Insights existed when I was a product executive years ago, because I had trouble finding, finding a market research company to help us with our roadmap. Yeah. And it's funny because in order to do good B2B market research, you have to know your space, right? Yep. So if you put me in the oil and gas industry and had me interview or executives in oil and gas, I wouldn't understand the nuances of what they were saying. I wouldn't be able to speak the language, right? So good B2B market research is really contingent upon having interviewers or having survey designers or people doing the analysis really know their market, and be able to interpret or expand upon what the market is saying.
Yeah, definitely good word, and really encourage folks, if you haven't already, check out elicitinginsights.com. Trish, if people are hearing about this report and going, gosh, I need to get me some of that, what's their path? Where would you direct them?
Sure. If you go to the elicitinginsights.com homepage, there's a button on there that will take you to information about the report, or there's also a market studies page within the Eliciting Insights website that has our various reports out there. We also have, if anybody's interested in the consumer study we did, the self-scheduling, that's available for download as well on our website.
Awesome. And we'll be linking out to that too in the context of the Healthcare Market Matrix show notes. So you can access it there if you're already tuned into that channel. Just follow the stream down the page, and you'll see the links to this to get those reports as well. Trish, anything else that would be good for folks to know? Anything else that you're seeing in the market right now that has you interested and intrigued?
I think automation, AI, It's going to be really fun to see where this takes us. I think we're all trying to get our heads around Chat GPT and what that means. It's going to be really fun to watch how this plays out, right? So, are we going to, in 2 or 3 years, are we going to have providers using Chat GPT to create denial or appeal letters to payers, and then payers using Chat GPT to create the denial letter, and we have Chat GPT arguing with one another back and forth. I think it's going to be really exciting to see where automation will take us. I think it's really going to. I think we're finally going to start to see the real payoff in the revenue cycle from from investments in AI, machine learning, natural language processing.
Yeah, I think it's going to happen remarkably quickly. I think that the market is extremely ready for it and very incentivized right now. We can't have clinicians spending time the way they're spending it, and we can't have administrators bogged down so deep that they can't see their way straight. And some things have to change in order for our system to survive, and the incentives are extremely aligned to see automation come through. We just have to, from a market perspective, we have to be very careful to understand what people are willing to do and spend on right now that is in their critical path. That's where Eliciting Insights comes in. This is a great report that you can access right now to help in that world. It'll give you it'll give you a great picture. So follow the links here. We're going to give you clear access to that. Trish, thank you so much for spending some time with us today. And thank you too for your investment with the Ratio Advisory Board. We're glad to have you there, and looking forward to watching that relationship continue to grow as we work together.
Awesome. And thanks for the opportunity to be on your podcast. Appreciate it.